Hi, welcome back. I'm Josh with Fisher's Health Department here with this week's COVID-19 Community Update. Today is Tuesday, August 3rd, 2021. So jumping right into where we are now. So right now the Hamilton County unique individual positivity rate is at 9.8%. Our Fisher's testing site is at 4.7%. That portion, the Fisher's testing site only, that metric is in green. But our case incidence rate, where it's the average daily cases for 14-day average per 100,000 people, that is up to 10.25. So that's the highest we've seen it in a while. So both Hamilton County and the case incidence rate, those are both individually in orange. Overall, our primary metric area is in yellow. Our secondary metric area with contact tracing, testing availability, testing turnaround remains in green. Our tertiary metrics are floating right in between green and yellow. So the hospital capacity in terms of ICU capacity is sufficient. Right now it's around 34% for our district, but we are seeing an increase in daily hospitalizations. Keeping a close eye on that. Overall, right now, our risk rating is still at level 1 green. But with the way the numbers are trending, it is very likely we will increase our risk rating next week on August 10th. Vaccinations are the key for us to be able to control the pandemic, to help limit the opportunity for the virus to continue to replicate and potentially mutate, and then develop into a new, more additional contagious strains, such as it has with the Delta strain right now. So we really want to get our vaccination numbers up. Now we do have a high vaccination rate for the eligible population. So right at that 75% mark for those aged 12 and older have received their first dose of vaccine. 67.6 or roughly 68% of the eligible Fisher's residents have been fully vaccinated, but that still leaves a large number of residents that are eligible, 12 and older, to receive their vaccine. Roughly 19,000 residents who have been and are eligible to receive one of the 3 emergency use vaccines have still yet to initiate the vaccination process. According to the CDC, 83% of all new cases were due to the Delta variant. In Indiana, where they are doing sequencing for the past month, over 87% of the sequenced cases have been the Delta variant. So this is definitely the leading contributor to the majority of new cases that we are seeing here. So the Delta variant is much more highly transmissible. It is much more contagious. There are a few ways to think about this. You can break it down in terms of its impact against vaccinated and unvaccinated individuals. I won't read all the text on this screen, but again, do pause it if you would like to read all of the text. But if you're fully vaccinated, your risk for a severe outcome from the Delta variant is inordinately low, particularly compared to individuals who are unvaccinated. Unvaccinated individuals are at a higher risk for infection and contracting COVID from the Delta variant than previous strains. It is a lot more transmissible. Each infection from the Delta strain leads on average to about 8 to 9 new infections compared to the original strain of an average of 2 infections. So it's spreading much quicker, or it has the ability to spread much easier, and it's much more highly contagious. And a good apt analogy for how contagious this is the idea of chickenpox. So you've probably heard this in the media. The new Delta variant is as easily and highly transmissible as chickenpox, so it can go from person to person quite easily. You have a high level of protection if you are vaccinated, both from infection and in particular from severe forms of the outcome. So community vaccination is key. We have over 19,000 individuals that have yet to initiate the vaccine process. There are 19,000 residents that are age 12 or older that are eligible that haven't initiated the vaccine process. We definitely encourage you to do so. If you are vaccinated or unvaccinated, you have your personal circumstances to consider on where and when and how you want to mask. We recommend masking. That is an additional level of protection that you will have. We also recommend universal masking for K-12 schools, including visitors. So please do take care of yourself, of your loved ones, your family by getting the vaccine. Call us with any questions, 317-595-3211. Thank you, and we'll be back next week on August 10th with our next community update. Have a nice day.